Good morning. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Now, in the last class we have seen some of the basic concepts regarding to congenital cardiac problems in children. And today we will have some of the symptom analysis. In the last class we have stopped here actually. The symptoms, we have seen the different symptoms. So sometimes there may not be any symptoms at all. Sometimes there may be very severe symptoms. And the symptoms may vary up to the heart failure also circulatory shock also. There will be mostly heart murmur will be there in most of the time. Then sometime murmur may not be there. Then stridor will be there, hypercyanotic spells will be there, and recurrent respiratory tract infections will be there, which is very common, especially in the shunt pathologies, and growth failure will be there. So that we have seen. Now we will have a detailed description of one by one. If you look into the breathlessness, now breathlessness is one of the major symptoms in case of cardiac problems. Now, common pediatric symptoms which are related with the cardiology are chest pain, cyanosis, edema, clubbing, and breathlessness. Now, chest pain. When a child comes with a chest pain, does it related to heart or it is not related to heart? Should be identified because chest pain may be because of various reasons, starting from the costochondritis. So now, first we have to identify whether this chest pain is related to heart or whether this chest pain is related to cardiac, whether this chest pain is related to some muscles or some of the neurological system. The causes which are not related to heart are, for example, heartburn. Sometimes a newborn, especially infant or a toddler child may come with a chest pain. The cause may be simple heartburn, what we say gastric regurgitation, okay, reflux esophagitis, or sometimes gastroesophageal reflux disease. So here also child will have the chest pain, okay. Then sometimes because of the musculoskeletal problems, sometimes because of pleural effusion. Now some of the causes which are related to heart are especially pericarditis, myocardial ischemia, etc. Although it is rare in children, so these are some of the causes of chest pain related to cardiovascular system. Now breathlessness may be related to either, now when a child has got a breathlessness which is related to heart, not related to other parts of the body, related to heart. Now it may be occur because of the three reasons. Now one is breathless may be related to either myocardium or it may be related to either pericardium or it may be related to endocardium. Now thing is, the myocardium is an area, the muscular portion of the heart, isn't it? So this is the area actually where the valves of the heart are present. In the myocardium, valves of the heart are attached to the papillary muscles, which are further attached to the inferior surface of the ventricles that connect the cauda tendineae, so which are attached to the valves. So a leveler lesion involves all the three layers of the heart. What I mean to say is, suppose a valve involvement is there. Actually, valves are embedded in the myocardium. Okay, there's valves are actually present in the endocardium. They're exposed to the endocardium, but they have been pulled out and tied by the myocardium. So usually in a valve problem may lead to pain or breathlessness because of involvement of the myocardium and also because of the endocardium. Okay, valves are present in the endocardium. The papillary muscles, what we are talking, which suspend this valve, so they are present in the myocardium and also pericardium. So ultimately, what happens is all the three are get involved. Now, talking about the pericardium has got more sensory fibers. So mostly any infections on involvement of the pericardium is always painful compared to the myocardium and endocardium. The more painful lesion will be there from the pericardium because pericardium contains more sensory fibers. But pericarditis, it leads to more chest pain or breathlessness sometimes compared to the other. Okay. Now similarly, when we talk about breathlessness, a suck, rest, suck cycle. So this is very important in children. So one of the common presentation in the pediatrics related to breathlessness is suck, rest, suck cycle. Now, this means that an infant starts sucking the breast milk now, and it sucks the breast milk for a few minutes or few seconds sometime, and then he develop a breathlessness. Now, once he develop the breathlessness, the child leave the breast, and again after some time, child again starts sucking. So this particular question has to be asked with the mother very carefully whenever you are suspecting such cases. Okay, see, usually baby suck the breast milk for a few seconds or 1 minute or 2 minutes, etc. Then it takes a rest, and then again it start sucking. And so when it leave the breast, at that time the child is having breathlessness. So this particular history has to be asked. So important thing is there is a rest in between the two cycles. That means there is a rest in between two, and during the rest there is no dyspnea. Only when sucking comes to the peak after end of the 1 minute, the child is having dyspnea, it leave the breast, and once it leave the breast, the dyspnea comes down. Again, when dyspnea come to zero level, again child start sucking the breast milk if the mother is providing the same. Now, in this case, sucking will act as an exertion process for the baby. So when the baby is sucking, the intrapulmonary pressure rises, intrapleural pressure rises, okay, and as a result, it acts as an exertion process to the baby. And during the process, sucking, there will be increased pulmonary circulation, and the heart load increases because during the circulation, because of during sucking, always child has to maintain a negative pressure, and because of negative pressure, there is more what you say entry of the systemic blood into the heart. Okay, so during the process of sucking, there will be increased pulmonary circulation and the heart load increases because of this, and this leads to breathlessness. And if there is any existing heart disorders, suppose the child is having any existing heart disorders, then there will be breathlessness, because this is a process. Because during the sucking, baby always have a negative, maintain the negative pressure. While sucking, we need a negative pressure, isn't it? So because of this negative pressure, heart return, okay, after load, so that will go into rather preload, that will go into increase, and that leads to breathlessness because of pulmonary congestion. Now whenever there is a breathlessness, the breathlessness which occurs due to the respiratory disorders should be differentiated from the breathlessness which occurs because of the cardiovascular disorders. The breathlessness which occurs in the respiratory disorder is always continuous, and there is no rest in between, as it occurs in case of bronchiolitis, pneumonia, etc. Whereas a breathlessness which is occurring in the cardiovascular disease, there will be a rest in between. There will be a rest in between. A known cardiac disease like COPD or pneumonia, etc. So why there should be rest, isn't it? There will be continuous. Whenever there is a breathing, there is a problem, and continuous. But in case of serious disorders, it is not like that. It is a rest. Therefore, it is called a suck, rest, suck cycle. Now, usually we get breathlessness on exercise, so which is called as exercise-induced breathlessness. But on rest, he will be all right. So as it occurs in case of a exercise-induced asthma. Another important symptom related to congenital cardiac problem is cyanosis. Now, reduced pulmonary flow is one of the major cause of a cyanosis. So cyanosis can occur because of two things. One is if there is mixture of a pure and impure blood, and another one is if the blood flow to the heart itself is decreased, because blood flow to the pulmonary area itself is get decreased, because blood flow to the lung is very important for the purification of the blood. Suppose the blood is not at all reaching the lung at all, blood remain unpurified, and that will circulate, and that leads to cyanosis. So reduced pulmonary flow, defects in the right heart is one of the major causes. Similarly, left to right shunt, for example in case of VSD, which is commonly seen in case of tetralogy of the phalanx, or sometimes there will be abnormal ventricular arterial connections, okay, like transposition of the great vessels, etc. And there will be mixing of the venous and arterial blood, like single ventricle, etc. So these are some of the conditions where we can find cyanosis actually. Okay, most commonly reduced pulmonary flow. For example, pulmonary stenosis. One of the congenital problem is pulmonary stenosis. The blood is not going to the pulmonary area etc. At all. Pulmonary area at all. It is not going. So definitely there will be cyanosis. Another one is VSD-like condition as seen in case of TOF, where there is a mixing of pure and impure blood. Again, the percentage of oxygen saturation will come down, and there will be cyanosis. Or sometimes there is a mixing of the venous and arterial blood in a single chamber, like a single ventricle, etc. Another important symptom which is explained for the congenital cardiac problem is heart failure. Now, heart failure is seen in extensive cases. Okay, in the later part of the problem or end stage of the disease, usually the problems end up in heart failure. So, volume overload in defects with the left to right shunt, ASD and PDA. Now, some of the defects like VSD, ventricular septal defect, atrial septal defect, and patent ductus arteriosus. In these defects, actually, what happens is, so there will be overflow of the blood into the heart. Now, in case of VSD, there is more blood going across the ventricles, and as a result, the heart load will increase, because anyway, heart has to push this blood outside. and in the process heart may works more and ultimately it may end up in heart failure. Similarly, pressure overload in pulmonary and aortic valve stenosis. Same thing occurs in the stenosis of the aortic and pulmonary valve. If there is a stenosis in the aorta and pulmonary area, what happens? The blood remain in the ventricle, and now heart has to somehow it has to push this blood outside. Sometimes intrinsic myocardial disorders like cardiomyopathy, again, there's a problem with the contraction and relaxation, and decreased or increased diastolic filling, as it occurs in case of arrhythmias of different types, may also lead to heart failure. Now, another series of the symptoms which is seen in case of a congenital cardiac problem is a heart murmurs. Details of the heart murmurs again we will see later. Heart murmurs can be found in older children and also in infants. Now, usually the murmurs are there because of the abnormal pressure gradient. Some of the common murmurs, continuous murmurs, will be seen in case of patent ductus arteriosus because blood is flowing through an abnormal connection. And pansystolic murmur is very common in case of the VSD because during the whole systole it is pushing down. Okay, so because of the shunt, when the ventricle is contracting, blood is going through the shunt into the right ventricle or somewhere else instead of aorta, and it is happening during the systole, therefore it is become a pansystolic. Similarly, mid-systolic murmurs are very characteristic seen in case of atrial septal defects and also pulmonary stenosis, and mid-diastolic murmurs are common in case of aortic stenosis. Anyway, presence of the murmur is actually not an indication here. That means murmur intensity may varies. Now, intensity of the murmur on auscultation may be very high if the lesion is small. For example, if the VSD is very small, so the flow of the blood through that particular shunt, the small shunt, is very fast and forceful, and it may produce a loud murmur. But as the lesion increases or condition worsens, when the right ventricular and left ventricular pressure become equal, the blood is not much flowing, and that time murmur may disappear. So what I mean to say is harsh murmur, a loud murmur, is not suggestive of a severe heart disease, and no murmur is not suggestive of a absence of any problem. So murmur is actually not a good criteria to decide anything. If the murmur is present means yes, some problem is there, but murmur is not present means then you have to be more careful, because some of the lesions are when they become worse, the murmur disappears, especially right to left shunt and left to right shunts. So when the pressure in the left, both the ventricles get equalizes, there is no murmur because of the stagnation of the blood in the right and left ventricle. It does not suggest that there is no disease. Another important symptom is shock. Yes, cardiac malformations may result in shock sometime. Suppose if the lesions are like hypoplastic ascending aortas, or if there is aortic atresia, which result in low cardiac output leading to shock, and child appears extremely ill with the cold extremities because of the shock. Because now here in these lesions what happens is blood is not pushed outside at all properly because heart hypoplastic ascending aorta. Ascending aorta itself is not completely developed. It is a hypoplastic. So sufficient amount of the blood cannot be pushed out from the heart into the peripheral area will going to suffer, and that may lead to shock. Aortic atresia, if there is no aorta, then again descending aorta etc. will not be there, and blood is not reaching the tissues and cells etc., and it may lead to shock. Then low blood pressure and peripheral cyanosis and semi-comatose conditions can be seen with this particular shock. Another important symptom is hypercyanotic spells. Now, cardiac malformation with the pulmonary infundibular stenosis. Now, if malformation is more on the right side is connected with the pulmonary area. Now, if there is some problem like infundibular stenosis is there, pulmonary stenosis is there, infundibular stenosis is there. Infundibular area is an area where actually the pulmonary trunk starts. Okay, if the problem is there itself, the blood is not at all going to the pulmonary area at all, pulmonary trunk at all. So there is no question of purification of the blood, and definitely there will be cyanosis. Now, whenever the muscular outflow tract contracts, the blood flow to the pulmonary tract diminishes and patient develops intense cyanosis, and this is called as hypercyanotic spells. This is very common in the phallus tetralogy because phallus tetralogy, one of the component is pulmonary stenosis. Another symptom which we have to look in case of this congenital cardiac problem is a stridor. Some of the malformations leading to the compression of the trachea and bronchi may lead to stridor sometimes. Chest pain, already we have seen the malformation like anomalous origin of the left coronary artery and severe aortic stenosis may lead to myocardial ischemia, and patients may present with the episodes of streaming, pallor, and as well as chest pain. Now, there are some of the other symptoms also related to congenital cardiac problems that we will discuss in the later class. Thank you very much. Please don't forget to subscribe my channel. Again, we will meet again.